it's up to you on how you want to, I guess, present your experience. But maybe if you can start out by telling us what experiences you had, or when did you realize that you wanted to be a registered kin back in when you were an undergrad student?
Well, when I was an undergrad, thank you for that introduction, by the way, Tiffany.
You're welcome. Yeah, we're glad to have you. It's great to see you again.
Absolutely. I'm glad to do it. And so is Darian. We're really excited. So it was a 2013 year that you were required to write an entry to practice exam with the College of Kin to be registered. So that was all very, very new and exciting. And I chose to write in 2014 and went through that experience. I thought it was just the best course of action. You take the time to do your degree, and you want to make sure, particularly if there's changes happening on a legislative level that are going to be governing what you can and can't call yourself or can and can't do, that it was important to take that if that was an opportunity presented to me. And I did. Started there. Do you want me to just sort of run down or expand on what I've done, I suppose?
Sure. You know what? Sometimes what I like to do is have our speakers bring us through like what you would see in a typical day.
Okay. Well, that varies based on what you're doing. So I'm going into my dissertation right now, and negotiating a new role. We've recently moved. And so I am set to actually start at a neuro rehab clinic the end of November with a new piece of technology called PONS, which it assists people with mild to moderate brain injuries with regaining their balance. It's like an EMS based piece of technology. You put it on your tongue, and and it works on principles of neuroplasticity. They've seen a lot of results with it, which has been good, but I will be taking on a caseload of those patients. But there's been a lot to sort of be able to get me to that spot.
Sure.
And all of that is quite new. I think upon graduating, my role, even though I was a registered kin, was still sort of that of a rehab assistant type position in a private clinic, where although you're multidisciplinary environment is, I think, what it's called, you're autonomous, but in a very small sense of what your scope of practice is. So I was very much exercise prescription, exercise based, depending on what the practitioner had sort of deduced from their assessment. And as I gained, they gained confidence in me, and as I learned more, I was able to take on more and more of an independent role.
Okay.
And they had a situation, and this was very sort of situation specific, where I was seeing neuro patients from one of the practitioners, and for personal reasons, the practitioner had to take a leave. Okay. And I was sort of left with those patients, and it really forced me into research and reaching out and trying to find the best way to manage under guidance of another practitioner, but it was still primarily my role, which prompted me later to then do my master's. I do say it's great to want to do good and to be good, but it's also important to be competent in what you're doing and in wanting to help people.
I think that's a really valid point, especially when it comes to rehab. Would you be able to tell us, maybe for the students that haven't taken a neurophys course or anything like that, what are some typical cases that you would see in a neuro rehab clinic?
So it can vary greatly. It can vary greatly. So you can see more of a geriatric population. You could be seeing people with Parkinson's, with dementia. Um, with with MS, you can see people who are like recently discharged from hospital. You can see people who have had, their neurotrauma was years ago, but they're looking to, or they've been perhaps deconditioned, but they're looking to be stronger or maintain, what they have left with certain conditions.
Okay.
Yeah, with you see AVMs and then stroke patients and
Yep.
yeah, lots of
All right.
yeah.
That's great. Thank you. And what type of it, like, what's your role in working with them? Like, is it assessment? Is it treatment? Is it a combination of both?
So I suppose I would say it's not assessment in the traditional sense, because we don't, at least when I came out, I didn't come out with the knowledge to be able to do that. There is assessment
Sure.
that I've learned, but even in the case of this population, my job is not to diagnose. Someone else has done that part for me, and they're delivering them to me saying, this is what their issue is. This is what happened to them. This is sort of where they are in their recovery at this point. And you can usually see what needs to be done. Obviously, on my end of things is very physical. So it's, gait retraining, helping someone to learn how to sit to stand, come out of a wheelchair and be able to stand and to weight bear, to take their first step, to be able to walk across different surfaces or to walk up the stairs. Sometimes it's just being able to, stand long enough to do the dishes,
For sure. Maintaining the activities of daily living and getting them to where they need to be again.
Absolutely, yeah.
What do you love most about your job?
I love most, selfishly, not all the time, but there's a lot of gratification for me that comes with working with the neuro population, because they can make leaps and bounds quite literally, and it can be very emotional for people. Your work means that much more to someone who really needs it, or they're not entirely sure. Their life has changed in this major way, and they're not entirely sure how to progress, or they don't feel that they can do certain things that they used to or that they like to do. But it's fantastic what rehab in some cases is able to encourage them to achieve, and where technology sort of meets on that other side to help them get back to whatever it is that they do. And that's my preferred demographic to work with.
Oh, that's great. What do you find most challenging about your job? I imagine that, rehab is a challenging field in itself. But is there anything that specifically you find to be pretty challenging in the field?
Not working with patients, funny enough. There's not a lot that's new in the world of neuro rehab. It's all pretty tried and true. We have what we have at this point. But professionally speaking, I do find KINs don't really work in this space from what I've seen in my experience. It's very new to a lot of professionals, and having to really advocate for what I do and what I know and how I am helpful and in a particular way. So that has been that's been a challenge.
Sure.
Yeah.
I would imagine, it's a relatively, it's a new registered profession. And I think it, like any new field, it'll take a bit of time for registered KINs to understand their place, but not even understand their place in the rehabs settings, but for everyone to understand what they bring to the situation. And it's a lot.
Yeah, absolutely. It's a lot of education and understanding, again, as as the college develops, and a lot of educating. That's what I'll. That's
For
what.
sure.
Yeah.
Good. I'm just going to see if I'll stop for a second and see if any of our participants here have any questions. And if you guys have any questions, you can take your mic off. We'll make this a pretty informal chat. Alyssa's here. If you have any interest in kin or writing your registered kin or neuro rehab, she works in the field. So anything specific.
Hi, Alyssa. So what was like your timeline of becoming a kin and then going back and doing your master's out of like undergrad?
So I had about about a 3-year gap. And that's because my husband and I took turns doing our masters. So we had worked for a year in Canada together, and then he went to do his master's in physiotherapy. And when he finished, I then started my master's in neuro rehab.
Okay.
And then prior to that, you were in personal training as well, right, Alyssa?
Prior to being registered, I was personal training. I was a personal trainer on campus too.
I remember that. I was going to say, and you used to, I know you used to work with Marcia
Yeah.
a bit too. So was that with coaching or some sports psych?
That was with track. So she was one of the
Yeah.
coaches. So I was training with her for a period of time.
So that would have been a really good experience for you too.
Yeah, absolutely. Yeah, so personal training, and then my first registered kin role was in the private rehab clinic, which was just your typical sort of orthopedic NMSK clinic. And then moving to the UK was interesting because they don't have registered kinesiologists there. So again, with the people are like, you're a kinesiologist. That's very interesting. What does that mean? What do you do? And that system was a little bit different, but for anyone who is looking to go, abroad and do something different, there is space. There is space for you to be able to do that, which I wish I had someone tell me, would have been a little more encouraging.
Sure.
And then an opportunity opened up at a slow stream neuro rehab clinic, and I was applying for a job, and they read my resume and they said, that's interesting. We've never seen anyone with that sort of set of skills before. We'd like to use you in some way, but we're not entirely sure how. And they said, a lot of their patients they felt were deconditioned, not necessarily, they were getting worse, not because their condition was getting worse per se, but just because they were sitting around doing nothing. And they said, we want to bring someone in to implement a program, but someone who doesn't have to make any clinical decisions. Can you put together some sort of program that they can deliver that would be safe and effective for them? So that was a project that I took on there at that clinic, or at that center rather.
Can you explain what a slow stream clinic is?
So a slow stream rehab center. So for patients who need a lot of care, and that could be because they have behavioral problems. A lot of the TBIs that were there were behavioral problems. It was a secure code entry facility, and they were there for a long period of time. It was set up as a nursing home, but that's not to say, it ran very similar to a nursing home, but that's not to say that the patients were expected to stay there. They were trying to be rehabilitated back into the community as well as physically.
Okay.
Yeah.
Great.
And then that brought me to my master's after that, which again has been interesting. That particular program at that particular university is open to all healthcare professionals that work within neuro rehab, and Yeah, it's been an interesting ride. It is a predominantly physio-heavy program. All of the professors are physiotherapists, which a couple are exercise physiologists.
Okay.
And so in terms of being able to learn alongside physios, which is who I predominantly work with in the workplace, was really helpful. And you learn a lot. There is a large overlap in scope, and I think skills that are very valuable for us to, as kinesiologists, to learn how to do as well. Again, not necessarily with the same purpose as, not using them the same way a physio would necessarily use them. We're not allowed to communicate diagnosis, for instance.
Right.
But, you know, it's important, I feel, as a professional to be able to distinguish what it is you're working with and to be certain that it is something that you can work with or something that you should not be working with. And having some of those skills help, particularly in the rehab setting, I would say. So that's been great. And hopefully my dissertation gets finished sooner rather than later. And we'll try to tackle the both. Yeah.
I think that that it's great for students to hear how your experience in the rehab environment has been. I think when students first come into kin and they want rehabilitation, their immediate thought is that they need to go into physiotherapy or occupational therapy. And although kinesiology they're warming up to the idea of being a registered kin, they're not quite sure, just as we were saying, where exactly they fit. You know, and sometimes, you know, they know that they can work alongside physiotherapists, as you said, work in that environment. I mean, it's more of a rehab team, and the kinesiologist is an equal member of that team. And I think that the more they're exposed to experiences like you've had, I mean, it's remarkable that the population you've been working with and, you know, now the research that you're a part of, it's great for the field of kinesiology. And hopefully it'll just continue to grow and more registered kins will have experiences like you've had and be able to actually demonstrate your skills. Now tell us a little bit more about this research that you're involved in with the ponds.
Yeah.
Sounds really exciting.
Pardon?
That sounds really exciting.
It is really exciting. You know, it happened by fluke. I will say I have sort of narrowed myself into a corner with being so specific in what it is I'm interested in and sort of put all eggs in that basket, I'll say. But a job posting that had come up for a kin with neurological experience. And I said, how interesting. So I'd gone in for that interview and they had, you know, said that there's this new modality available, which I had never heard of, and I was very skeptical of it at the time, and it really allowed me to put my new critical thinking skills to the test. And at that point, we couldn't make the job work for personal reasons, but it was a great bridge built, and I said, how would you feel if I did my dissertation on the technology? And they thought that was fantastic. It took a lot of negotiating.
Great. Yeah.
Yeah, my supervisor.
That's making lemonade right there.
I'm telling you. You know, really got to, you know, put yourself out there in that sense, and also like, don't take for granted the skills that you're learning, because I promise you they come in useful. I promise you will use them.
Yeah, you just have to wait for that opportunity, right? Like you said, who knew that something that specific would have appealed to you? And then when that didn't work out, you made it appeal to you.
I'm glad that you said that. I'm glad that you mentioned that, because one of my questions was going to be like, what advice would you give to like a new HK student, and you know, that they could take with them, that you've taken with you, that has really helped. So that you kind of answered that right there. So that's great.
Yeah.
Absolutely.
So specifically, I suppose what I'm looking at is rate of response to this particular piece of equipment. You know, when you run certain statistical analysis a particular way, your results come out a particular way, shall I say.
Mm-hmm.
I've been privileged enough to have this information, and so I have to be careful about what I share if I'm being very vague. But you can also take that same data and analyze it a different way, and that can give you new information about the results. So that is effectively what I'm doing. I'm taking the raw data that they used for their primary study, and I'm looking at individuals at all their test points and how quickly they responded, and hopefully in future, that might give an idea as to, or it can inform research onto why certain people respond quicker than others, or later than others, or why certain things happen. So that's what my dissertation is going to be about.
Oh, well, that's good. That's wonderful. Make sure you keep us in the loop on that.
Absolutely, yeah.
And I'll kind of bridge off of what Joanne had asked about what would you tell a kin student, and I'll get a bit more specific. So if you were to speak to a student who were in first, second, third year, let's go up first and second year. A first and second year kin student who wanted to pursue the path that you did, what are some things that they can do early on that either you did do that helped you along the way or that you wish you had done?
First and foremost, and this doesn't necessarily apply to specifically the field of neuro rehab as well, but experience. 100% without question, what employers need is someone who knows how to do, I don't want to say be their hands per se, but within rehab, some of it is more manual therapy, things that technically fall under our scope, but you might not learn from a course per se. But I had volunteered with, I had done my internship at Windsor Regional Hospital and got experience working with stroke patients and learning how to do sit to stands and gait and all that stuff through there. That was fantastic. And working with the cardiac rehab program. Mm-hmm. Don't know if they're, I mean, no one's doing any programs right now, but I don't know.
There are a lot of new opportunities since you've even been there that have been implemented. We actually have an entire center now for health and physical activity. And we've got specialized programs, partnerships with Community Living to work with individuals with intellectual disabilities and exercise programs. So there are thankfully a lot of opportunities for our students to get those practical skills that you're talking about, because I mean, we recognize how important it is for sure.
Absolutely. That's absolutely amazing.
Yeah, it's been really great. It's been a good addition to the program for sure.
Yeah, so that I would say first and foremost, get familiar with the patient group you want to work with. How do symptoms present? What are some of the difficulties that come with working with that particular patient group? Because as much as you're doing rehab, when you're working with people with intellectual disabilities or some TBIs, like concentration is a real issue, and that's not necessarily direct manual therapy or exercise prescription per se, but that comes into coaching them through it and getting a feel for what you need in your tool basket and filling in those gaps best you can before you go out. There's tons of information out there.
Yeah, absolutely. So getting involved, that would be, getting those practical skills. And we also, students that are in the movement science stream are required to take the undergraduate labs, which would have been there when you were a student as well. So those are great skills they can take with them in their toolbox too. And what about students who maybe didn't realize that kin was I've got my family home. What about students who are perhaps in fourth year who didn't realize that they might want to be a registered kin? What are some things that they can do now?
What are some things that they can do now? Get familiar with what's going to be required of you, I would say. I know the college has a list of core competencies, and I know that's changed a little bit over the years, but again, it comes down to practical skills. People want to know for in the interest of the public and the people that you will be serving, that you know what you're doing,
Right.
Which is the benefit of being registered. I suppose it gives the people, your clients that you're working with, that safety net of knowing that you are accountable to someone if, you know, if something goes wrong. You are held to a particular standard. Ask questions, you know, look at it, you know, attempt to fill in any gaps you have, additional courses you want to do. It's all up for grabs. Yeah. I'm in an area that I've definitely had to forge myself, and don't be afraid to do that either. If you know what your role is, if you know it well enough, you can find areas that you can fit into and advocate for yourself. You know, do all your checks and do all your homework, but advocate for yourself and what you can do and can do well for servicing your clients and patients.
Absolutely. Yeah, I love that. That's great advice. And Joe, did you have a question as well? No, you're good.
No, I think I'm good. I just wanted her to, you answered a question first off, and that was great advice for our new students. I really enjoyed that. That was great. Absolutely.
Maybe what I'll do is I'll open it back up to our students, and now hearing a little bit more about Alyssa's experience and journey. I know that Thomas had asked a question. Anyone else have any questions specifically about even what she's gone through for the registered kin exam? Oh, I see Kevin's mic is on. Maybe he has questions.
No, I was going to wait for students.
You can go. I'll let you go.
Oh. No, I was just going to ask, I got cut out for a second in there, but you know, Alyssa may be talking about taking the jump to go across the ocean. You know, you're in a new world, a new land. You have, you know, so many new things to learn at the same time as, you know, starting a life and whatever. And maybe speak to the students that are here about, you know, I don't want to say, was that a good decision, or just, I guess you know, taking that jump to go out there. It's probably, you know, filled with a lot of fear, but, you know, would you recommend that students do something like that?
Coming out of the other side, I can now say with full confidence, yes, you can do it. You know, it took a lot of researching, you know, beforehand. We moved out there. I had no job. I had no job lined up. But again, we had situated ourselves in a way that we had a buffer for that amount of time. In the UK, they have sports science, so there is some overlap there, but it is not, unless you're an exercise physiologist, and even then, the sort of growing that kinesiology is dealing with in Ontario is the same sort of field that exercise physiologists are dealing with in the UK, in the rehab setting per se, and professionals understanding what it really is they do and where their place is. Physios have a very, I feel like I'm maybe going off topic a bit, physios have a very wide scope over there, and you will notice those differences, and those were all things that I had to learn going on. Areas where in Ontario I was certain that I fit were now under someone else's umbrella, and by the general public that was seen as the best that was available to them. I ended up taking a rehab assistant position, and their system is banded, so you could be a rehab assistant at various levels, and that indicates your pay and levels of responsibility. And that was not and I would say something to consider is that when you go, and the potential for there to be a gap in your experience, and what you're able to do and learn. There are many opportunities for you to do other things. They have great high-level sports programs, community recreation teaching, all those things are great, but particularly in terms of rehab, not the same learning opportunities that you would have here. But it's an experience, and it gives you a deeper level of understanding. One thing you can take away, from life, I suppose, is the way things are done, and in one country can be considered best practice, can really change when you go somewhere else. And something you thought you were so sure of and so sure was the right way to do things might not matter when you go somewhere else, if that is an established sense of what is appropriate. I don't know if that's too vague, but there are differences in culture. A lot of people over there, in my opinion, are not into exercise the same way people are. I'll keep it to Ontario. I can't speak for the whole country, but it's different. The level of the relationship between therapist and patient is different because the national health system over there is all publicly funded. So where you will, I think, anyone would assume, you're in Ontario, you sprained your ankle and you go into the physio, you expect certain things and for things to be resolved in a, relatively, fast manner, depending on the level of your injury. Things move very slow over there, and the level of expertise, the level of knowledge varies widely depending on whether you're seeing a physio that's a band 5, which is entry level, or a band 8, which is consultancy level, or anywhere in between. People don't always want to get better to to their absolute best. They don't want to be able to run. They just want to be able to walk to the shop and get their messages, get their groceries, and that's it. So I think I've rambled a bit there, but you learn a lot. You'll take away, even if not for your career specifically, important things you'll take with you, how to adapt to different situations. But a large consideration is there may be a gap in your experience when returning back to Ontario, because there is not that autonomy over there that exists here in Ontario.
I might have something to say. I was just wondering, have you dealt with some students coming in to you with their knowledge, like say comparable to what you studied, and how you found it compared to your education with HK in Windsor? Have you find it similar or? Oh,
See? Sorry.
Oh my God.
It's you. I'm sorry to interrupt your question there, Joanne.
I'm sorry, I just came in from work, sorry.
That's all right. It's really nice to see you. Such a reunion. This is great. Sorry, do you mind repeating your question there, Joanne?
No, no problem. I wanted you to say hi to Marcia first. Of course. My question was sort of like the education system. Have you had any experience with students that were coming from the UK into your field, and how you would have compared it to your education that you got? Is there, I know that you said something about the bands, but somebody that was in the same education that you got somewhere along that line. I don't know which band that would fall into for that particular.
So I would say the most similar undergraduate program they have, or stream, so to speak, that they have is sports science. So in a sports science program, from my understanding, you will cover things like VO2 max and exercise physiology. Those modules or courses are quite similar, but the breadth isn't there. I don't see any sports psych. I don't see any biomechanics. I don't see any ergonomics that are a part of that. In terms of rehab, physio is a 3-year undergraduate program. So when you're having a new grad physiotherapist, it's different. Again, just in comparison here, the level of I don't know if it's fair to say the level of knowledge, but perhaps the level of professionalism, perhaps. I mean, in Canada, you go through an undergraduate degree and then you go through a master's. So your academic experience up to that point that you're able to bring to that, I think, is valuable. And I think that comes across personally when I'm comparing the two. So that's what I would say. If anyone is interested in doing physiotherapy, you know, you could go to the UK to do that because, you know, it's a different process.
It's interesting. Thank you. Yep.
Yeah, no.
I'll kind of jump on what Joanne was saying there, and how did your BHK at Windsor prepare you for the career that you have now?
It absolutely did. It taught me everything I didn't know. For the, you know, all my basics. You know, I'm in neuro. I took all the neuro classes I could that were available. I draw on, you know, on things I know from sports psych, from, you know, biomechanics, although I don't, you know, use NIOSH equations or RULA. Like, I don't use any of this stuff in my day-to-day practice, but
I'm actually impressed that you remember that. That's great.
stage. But, you know, understanding, you know, how repetitive use injuries, you know, happen, that general understanding is great. And just once again, comparing being in a place where people were so specific in what they did, I really saw how that may be a limitation to what you're able to provide in terms of a holistic service to your patient or client. I had mentioned, you know, with some of the patients I see, it's not necessarily physical activity or manual rehab that is the primary issue, but sometimes it's their ability to concentrate. And how do you coach someone, you know, through that? Understanding, you know, all the little bits and pieces come into play. You do use a little bit of everything.
Yeah.
And there's honestly not one course I have not, you know, gone back into my notes and drawn from at some point.
Well, that's great to hear. I mean, I know that we always feel really lucky that we have a comprehensive program, and especially compared to, I know that I do a lot of the course equivalencies for students going on exchange. So I get familiar with some of the KIN programs internationally, and you're right, a lot of them are very specific to certain areas, and we cover so many. And I like that you spoke about a toolbox before, and, you know, it's almost like you're just, every experience you have, you're trying to get more tools into your toolbox, not really knowing when you're going to use them, right? But it seems like at some point or another in your career already, and you're young in your career, you've already been able to use all of them, or found an opportunity to use all of them.
Yeah, you try, you know, you work hard to get those credits, and to, you know, and it's not just so you can hang a degree on the wall at the end of it all, but, you know, I really emphasize that what you are learning, that you will use, it will benefit you to pay attention to them, and to, you know, not just understand how they work, but how they're applied, and how they can be used. The more you have in your toolbox makes you more marketable. Diversification, again, speaking, you know, in my personal opinion, there is great leverage in diversification. The more you know, and the more you're able to offer your patient or client, that, I don't want to say that's what makes you valuable. We're all valuable. You know, we all bring different tools to the table.
Sure.
It makes you more marketable if you are doing something different, or you have a, you know, a set of skills with, you know, a little something extra on the side that benefits your patient that you wouldn't otherwise normally find. That really allows you to, you know, create something for yourself and just be more marketable, I suppose.
Yeah. Well, I love that. I think Marcia has a question for you.
Yeah, bring it on.
Hey, Tiff, how did you know?
I saw you just like pawing at the screen, like.
So you saw my finger just reaching for the unmute button?
Yeah.
Well, see, now I came in late, so you might have already addressed this question, Alyssa, but do you want to, I'm going to ask you more a holistic question to talk about and how you manage balance as a undergrad student compared to now balance in your career, or you're early and young in your career and now have a family. So what was that transition like for you? And I will mute myself so you can respond.
Like studying, do you mean? Like being an undergrad versus being a student in this time in my life? Is that what?
So being a student and like the challenges and learning and everything that you had to face compared now to being in your career where you have to turn around and apply this, balancing your career plus balancing, being a mom.
Yeah.
And having a family.
Yeah.
Yes, Alyssa, tell us how you do that.
Take the time while you have it. I can't stress that enough. I cannot stress that enough. The amount of flexibility, I can't speak for everyone's individual situation or circumstance, but the amount of opportunities that are available to you in undergrad is, I was not aware of how much opportunity that I was presented with there. And you have a card, you have a free card because you're a student. You can almost go anywhere if you're interested in what they're doing and say you're a student and you're interested and you'd like to come and see, they will probably say yes. If you are someone who is situated in your career, not a student who just says, I'm interested in what you're doing, I'd like to come and see. There's a little bit of like, not too sure. Again, that was my experience, but there across the board, there's an immediate understanding when you're a student that you are trying to, gain knowledge and take things on. Go abroad, go do an event overseas somewhere and come back if you don't want to be away for years. You use up the time that you have. Having a family is wonderful. And I don't think people talk enough about the impact that it can have, particularly for women, and the pause that it can put on your career. And as much as people say, you can do it, you can just sleep less, you can just, power through it, find a way to make it work. It's, every situation is different, but it is significantly more difficult to do. I'm still finishing my master's at this point and going to be starting a new job and, being mom and wife, and that takes a lot. I don't have the freedom to just pick up and go overseas for, an event that might be available to me. I think Just Diction actually posted, there's like a Olympic Committee junior committee that they're putting together, which would, I would love to apply for that. Can I pick up and go to, wherever they are? No, I can't do that. But that's a tangible opportunity that may still be present to a lot of people in their undergrad. And, the more you can prepare yourself and familiarize yourself with, I right now am on a committee. I'm on the discipline committee for the College of Kinesiologists at the moment, and that's a lot of it's a learning curve to be working at that level. Mm-hmm. When you leave the clinical hands-on role and your general understanding of who makes the decisions and how do they trickle down, and usually that starts at government levels, and so being able to be involved in things like committees, and understanding that hierarchies, as simple as learning what Robert's rules are and how they work in a meeting setting, are skills to learn. Get out and do every and anything that you can, because it does, it does change.
No, excellent. Thank you. What is it?
Is it on?
No, it's off.
I just had a question. I'm planning on writing my exam, like to be a registered kin next year. And I wanted to know, was it hard finding a job after like you passed your exam? And do you have any tips like during the writing process, like when studying, that you could give me?
Ooh, see, I wrote a little while ago, but I wrote the exam a little while ago. Sorry, you had a two-part question. It was, can you just repeat it so I can
just tips for like the writing process, like anything like that. And then was it hard to find a job after you did pass like your exam?
So it wasn't hard to find a job after. If you go on Indeed and you type in registered kinesiologist and you look at the types of jobs that come up, in order to use that title, if that's what you're looking to do, you have to be registered. There's no way around that really. And anyone who is, or kind of makes a suggestion that, you know, you don't really have to be registered with the college, but you can work, that's not really allowed. So I think it is highly beneficial. I think when you're marketing yourself, that's leverage for you. The fact that someone's holding you accountable, and the fact that you have to write a competency exam to be able to have that designation, that speaks a lot to what you're able to do professionally, what you understand. In terms of tips for writing, like I said, I wrote a long time ago. But knowing the practical applications as well as the theory is really important. The theory can help you sort through some of the answers, from what I recall. And sometimes it's just memorization. Like if you understand your anatomy back to front and in and out, that can inform a lot of other areas, I'll say. There are areas on, biomechanics, on motor control, and you don't really know what's going to be on there. The practice questions were a huge help to me, so I would highly advise to look at the practice questions.
Okay.
And your exercise prescription, in all facets, in terms of healthy people, in terms of disease populations, and your disease pathology as well.
Okay, thank you.
Yeah, no worries.
Thanks, Nicole. That was a good question. All right, do we have any other questions for Alyssa before we wish her a great day? What time is it there?
Well, we're in Ontario, so it's
oh, you're in Ontario right now. I thought you were in the UK right now. That's right.
Yeah, so it's just after 3:30, or just
same as us. Same.
Yeah.
All right. Well, listen, this was wonderful. I want to thank you on behalf of the whole department for coming back. It's wonderful to see you again. I can't believe it's been 7 years since I feel like we used to see each other weekly.
Yeah, absolutely.
All the time. This was great. And you look exactly the same. And your daughter is beautiful. And you and Darian look great. And I'm excited to hear him talk about his career in PT. And thank you for everything that you've been able to speak about. I think my favorite kind of takeaway message from your talk today was when you knew that an opportunity couldn't work out for you, like the job in neuro rehab working with the Pawns. It would have been an opportunity, a career opportunity for you. And when it didn't work out, you took it upon yourself to offer to do research on that technology for them to get that job, right? Like to get the job in a different way, to still add to your toolbox. And I think that took a lot of courage, and it's thinking outside the box, which comes with experience. So that's awesome. We wish you all the best with your dissertation, and let us know how it goes. And we hope you'll send us a picture of gown day.
Yes, will do.
I wanted
Thank you so much for having me.
I wanted to thank you too, Alyssa. It was nice meeting you, and thanks for letting me record this so that I can share it with students. It's great. Thank you.
Yeah, no problem.